Welcome to Pediatric Case Review. Today we'll be discussing non-accidental injury in children, a critical topic for all clinicians working with pediatric patients. This lecture aims to improve recognition, evaluation, and management of suspected child maltreatment. Let's explore this important subject together. Let's consider our first case. A 2-year-old presents with multiple bruises in various stages of healing on the back, buttocks, and behind the ears. Which of the following is most concerning for non-accidental injury? A. Location of bruises in non-bony prominences. B. Parent reports child is clumsy. C. Child is developmentally normal. D. Bruises are all the same color. The correct answer is A. Bruises located on non-bony prominences such as the back, buttocks, and behind ears are highly suspicious for non-accidental injury. Remember the 10-4 rule. Bruising on the torso, ears, or neck in children under 4 years of age should raise immediate concern. Accidental bruises typically occur over bony prominences like shins, knees, and foreheads. Additionally, premobile infants rarely have any bruising. Those who don't cruise rarely bruise. Our next case involves a 3-year-old who presents with circular burns on both palms. Which burn pattern is most suspicious for non-accidental injury? A. Splash pattern on chest. B. Symmetric glove immersion burns on hands. C. Irregular burns on anterior thigh. D. Linear burn on forearm. The correct answer is B. Symmetric glove or stocking distribution immersion burns are highly suspicious for non-accidental injury. These burns show clear demarcation lines between burned and unburned skin, indicating forced immersion. The circular burns on palms described in our case might represent cigarette burns, which are also concerning. Accidental burns typically show splash or spill patterns with irregular borders. Remember that burns account for approximately 10% of physical abuse cases. Consider this case. A 6-month-old presents with lethargy, vomiting, and seizures. Which finding is most specific for abusive head trauma? A. Epidural hematoma. B. Retinal hemorrhages in multiple layers. C. Single parietal skull fracture. D. Small scalp hematoma. The correct answer is B. Retinal hemorrhages that are bilateral, extensive, and involve multiple layers of the retina are highly specific for abusive head trauma. While a single, linear parietal skull fracture could be accidental, epidural hematomas are more commonly associated with accidents involving direct impact. Abusive head trauma often presents with subdural hematomas, retinal hemorrhages, and encephalopathy, sometimes called the triad. The absence of external trauma with serious intracranial injury should raise suspicion. Here we have an 8-month-old with a swollen leg. X-ray shows a corner fracture of the distal femur. Which of the following fractures is most specific for non-accidental injury? A. Transverse midshaft tibia fracture. B. Linear parietal skull fracture. C. Posterior rib fractures. D. Clavicle fracture. The correct answer is C. Posterior rib fractures are highly specific for non-accidental injury as they result from anteroposterior compression of the chest, as might occur with violent squeezing. Metaphyseal corner fractures, like in our case, are also highly specific for abuse, resulting from twisting or pulling forces on developing bones. Clavicle fractures and linear skull fractures commonly occur accidentally. The age of the child and developmental stage must always be considered when evaluating fractures. A 15-month-old presents with facial bruising. The parent reports the child fell from a couch. Which examination component is most important in evaluating potential abuse? A. Focused exam of reported injury only. B. Complete physical exam including all skin surfaces. C. Neurological exam only. D. Growth parameter measurement only. The correct answer is B. A complete physical examination, including inspection of all skin surfaces, is essential when evaluating potential abuse. Children should be fully undressed to allow thorough assessment. Document all injuries with measurements, description of stage of healing, and photographs when possible. While growth parameters and neurological examination are important components, a comprehensive approach is necessary. Always assess whether the reported mechanism is plausible given the child's developmental stage and the nature of the injuries. A 2-year-old presents with a torn frenulum and bruised lips. Which oral finding is most concerning for forced feeding or gagging? A. Dental caries. B. Torn labial frenulum. C. Canker sores. D. Teething bruises. The correct answer is B. A torn labial frenulum is highly concerning for forced feeding, forced pacifier insertion, or direct trauma in non-mobile children. This injury rarely occurs accidentally in infants who cannot walk. Other concerning oral findings include bruising of the lips and oral mucosa, especially on the hard and soft palate. While dental caries may indicate neglect in some cases, they are not specifically indicative of forced feeding. Always examine the mouth thoroughly when evaluating for possible abuse. A 6-month-old presents with bruising and suspected abuse. Which initial investigation is most appropriate? A. Complete blood count only. B. Skeletal survey. C. Liver function tests only. D. Urinalysis only. The correct answer is B. A skeletal survey is recommended for all children under 2 years of age with suspected physical abuse. Up to 30% of children with abuse will have occult fractures that are only detected through imaging. The skeletal survey should include multiple views of all bones. Additionally, laboratory investigations should include a complete blood count, coagulation studies, and liver function tests to rule out bleeding disorders or medical conditions that might mimic abuse. Consider head imaging in infants even without neurological symptoms. A 9-month-old presents with multiple bruises. Which laboratory test is most important to rule out a bleeding disorder? A. Electrolytes. B. Coagulation studies, PT/PTT. C. Creatinine. D. Amylase. The correct answer is B. Coagulation studies including prothrombin time and partial thromboplastin time are essential to rule out bleeding disorders that may mimic abuse. A complete bleeding disorder workup should include a complete blood count with platelet count, PT, PTT, and consideration of von Willebrand factor studies. Certain medical conditions like leukemia, hemophilia, and von Willebrand disease can present with bruising that might be confused with abuse. These investigations help ensure accurate diagnosis while protecting families from incorrect allegations. A 4-month-old presents with seizures and suspected abuse. Which head imaging modality is most appropriate initially? A. Skull X-ray only. B. CT head without contrast. C. MRI brain only. D. Ultrasound of head. The correct answer is B. CT head without contrast is the appropriate initial neuroimaging study for suspected abusive head trauma. CT is widely available, fast, and excellent for detecting acute hemorrhage and fractures. While MRI provides more detailed information about brain injury and timing, it typically follows CT and is not the first-line emergency study. MRI is recommended within 1 to 2 days when possible. Skull X-rays alone are insufficient as they miss intracranial injuries, and ultrasound has limited utility outside the neonatal period. A 1-year-old presents with suspected physical abuse. What is the first priority in management? A. Family therapy. B. Medical stabilization of the child. C. Interview with caregivers. D. Contacting law enforcement. The correct answer is B. Medical stabilization of the child is always the first priority in cases of suspected abuse. Address any acute medical needs and ensure the child is physically stable before focusing on the investigation. Once the child is medically stable, healthcare providers are mandated by law to report suspected abuse to Child Protective Services. While documenting the history from caregivers and coordinating with law enforcement are important steps, they follow ensuring the child's immediate safety and medical needs are addressed. A 3-year-old presents with suspicious injuries. The parents request that you not report your concerns as it would damage their reputation. What is your best course of action as a healthcare provider? A. Honor the parents' request if they seek a second opinion. B. Report to Child Protective Services as mandated. C. Wait for definitive proof before reporting. D. Report only if parents consent. The correct answer is B. Healthcare providers are legally mandated reporters and must report reasonable suspicion of child abuse to Child Protective Services. The threshold for reporting is reasonable suspicion, not definitive proof. Failure to report suspected abuse can result in legal consequences for the provider and continued danger for the child. While this conversation can be difficult, explain to parents that reporting is required by law and the goal is to ensure child safety and connect families with appropriate resources when needed. You examine a child with suspicious bruising. Which documentation approach is most appropriate? A. Brief notes stating bruising noted. B. Detailed measurements, locations, and photographs of injuries. C. General statement about multiple bruises. D. Documentation of only the worst injuries. The correct answer is B. Detailed documentation including measurements, specific locations, descriptions, and photographs of all injuries is essential in cases of suspected abuse. Use body diagrams to mark injury locations and precisely measure each injury. Document the colors of bruises or appearance of other injuries. Record direct quotes from the child and caregivers about how injuries occurred. Thorough, objective documentation is critical for child protection proceedings and may be used as evidence. Remember to obtain appropriate consent for photographs according to your institution's policies. A hospital is evaluating a case of suspected abuse. Which team composition is most appropriate for evaluating suspected abuse? A. pediatrician working alone. B. Multidisciplinary team including medical, social work, and child protection. C. Emergency physician and surgeon only. D. Psychiatrist and therapist only. The correct answer is B. A multidisciplinary team approach is the gold standard for evaluating suspected child abuse. This team typically includes medical providers, ideally with child abuse expertise, social workers, child protective services, mental health professionals, and sometimes law enforcement. Child abuse pediatricians, when available, have specialized training in abuse evaluation. This collaborative approach ensures comprehensive assessment of the child's physical and emotional needs, family circumstances, and safety concerns, while coordinating investigation and treatment planning. When evaluating family risk factors, which factor is most strongly associated with increased risk of physical abuse? A. Single-parent household. B. Poverty alone. C. History of domestic violence. D. Young maternal age alone. The correct answer is C. A history of domestic violence in the home is strongly associated with increased risk of child physical abuse. Other significant risk factors include parental substance abuse, untreated parental mental health issues, and social isolation. While factors like poverty and young parental age may create stress that contributes to maltreatment risk, they alone don't predispose to abuse. It's important to recognize risk factors to provide appropriate support services, but avoid stereotyping families. Most families with these risk factors never abuse their children. A pediatrician is planning abuse prevention strategies in their practice. Which intervention has the strongest evidence for preventing physical abuse? A. One-time parent education handout. B. Home visitation programs for at-risk families. C. Generic child development classes. D. Mandatory reporting laws alone. The correct answer is B. Home visitation programs for at-risk families have the strongest evidence base for preventing child abuse. Programs like the Nurse-Family Partnership, which provide regular home visits during pregnancy and early childhood, show significant reductions in child maltreatment rates. Effective prevention strategies include parent education about child development, support for positive discipline strategies, stress management, and connection to community resources. While mandatory reporting is essential for intervention, prevention requires comprehensive approaches that strengthen families and provide concrete support in times of need. As we conclude our discussion on non-accidental injury in children, remember these key points. First, early recognition requires knowledge of concerning injury patterns and developmental context. Second, thorough documentation and appropriate medical workup are essential for accurate diagnosis. Third, reporting suspected abuse is both a legal and ethical responsibility for all healthcare providers. Finally, a multidisciplinary approach provides the best outcomes for these vulnerable children and their families. Your attentiveness and willingness to address this difficult topic directly protects children. Thank you for joining us for this important discussion on pediatric case review. If you found this information valuable, please subscribe to our channel for more evidence-based pediatric education. We cover a range of important topics for child health clinicians each week. Please share your questions or topic suggestions in the comments below and join us next time as we continue our mission to improve pediatric care through education. Remember, recognizing abuse early can literally save a child's life.